High blood pressure, one of the major contributing causes of death and disability. The consequences of high blood pressure are devastating, and the majority of people that are 65 or older in this country have high blood pressure. As much as a third of all people have high blood pressure. Blood pressure is measured with two numbers. The top number, systolic blood pressure, represents the pressure of the blood in the vessels when the heart contracts. The bottom number, or diastolic blood, it represents the pressure in the blood when the heart's in its relaxed phase. Each is an independent risk factor for all-cause mortality. Each predicts your likelihood of premature death and disability much more sensitively, for example, than cholesterol or other common measures do. Blood pressure is very sensitive because it represents almost every organ system in the body. High blood pressure and its conditions, as I said, are the leading cause of death and disability in industrialized countries. For example, 5.7 million people get congestive heart failure. That's where the heart muscle loses integrity, and when it pumps, it doesn't pump the blood out efficiently. So if you have congestive heart failure and you lay down, your lungs can fill up with fluid and you can drown, which is why people with congestive heart failure often have to sleep sitting up. The major contributing cause of congestive heart failure, high blood pressure. Almost 800,000 people will have strokes. High blood pressure, major cause of stroke. Most people develop it during their lifetime, which means if you're 65 and don't have high blood pressure, you are abnormal. Because the average or normal people have hypertension. 42 million visits to physicians, and it's a leading justification for prescription medication. This is worth billions of dollars to the industry. Drug intervention, unfortunately, largely disappointing. The improved outcomes are really only those people with the very highest levels of hypertension where it slightly reduces risk of stroke. The majority of heart attacks and strokes from high blood pressure occur in people that do not have blood pressure high enough to justify medication. Now, why don't we just put blood pressure medication in the public water supply since it's such a common disease? Why don't we give everybody high blood pressure medication? Because they're dangerous drugs. In fact, if your blood pressure doesn't rise to a certain level, you're higher risk dying from the blood pressure drugs from the blood pressure itself. That's why people with a blood pressure of 138/88, who have 5 times the risk of dying of a heart attack, aren't given medications. Because more people would die from the drugs than that level of hypertension. The definition of hypertension was the level at which the risk from the drugs was outweighed by the benefit, and that only happens when blood pressures rise to a certain level. For every point you reduce your systolic blood pressure through diet and lifestyle change, it said you reduce your all-cause mortality risk about 1%, according to Pito from Cornell. And that risk reduction may go all the way down to as low as 90/60. This is how we manage blood pressure. 1, 2, 3, 5 different medications. And of course, the medications have all kinds of side effects from chronic cough, fatigue, impotence, and death. The one promise you make when you go to the physician is that if you go on these drugs, how long will you take them? For the rest of your life. Your doctor will guarantee you, you will never get well, you will be sick forever. That's the promise. Because they know the blood pressure drugs have nothing to do with getting rid of the cause of blood pressure. What does get rid of blood pressure? Well, we know that weight loss does. This chart represents thousands of studies, including meta-analysis. For every kilogram of weight you lose, there's a 1.6-point average drop in systolic blood pressure. You lose a bunch of weight, that can help lower blood pressure. Vegetarian, high-fiber diets, independent of weight loss, are associated with a reduction in blood pressure, as is getting rid of alcohol. Alcohol is a major risk factor for high blood pressure. It is not health food. Exercise will reduce blood pressure 7 to 8 points, which is almost as effective as any combination of medications, which average a 12-point drop. The problem with medications, of course, they do reduce blood pressure, they do reduce risk of stroke, etc., but they have all the secondary effects. John McDougall did a study at St. Helena Hospital where he got an average drop of 17 points. Combining these variables, we were able to do a study with T. Colin Campbell from Cornell University that demonstrated an average of 37-point drop in blood pressure with medically supervised water-only fasting. And that was a paper that we published in JMPT and is available on our site. You can read this study. 174 consecutive patients with high blood pressure, 174 people achieved blood pressure enough to eliminate the need for medication. And in stage 3 hypertension, people you could justify medication on where their average systolic blood pressure starts at 180 or more, the average effect was 60 points. Now remember, the baseline was taken on medication. The conclusion, they're all off medication. So it's 60 points plus whatever effect the medication might have been having at suppressing their baseline. That's the largest effect that's ever been shown in any study in treating high blood pressure in human beings. It was published by the True North Health Center in conjunction with T. Colin Campbell, medically supervised water-only fasting in the treatment of hypertension. Moderate levels of hypertension responded proportionally. We spent 12 years collecting the data, processing it, being rejected by 30 medical journals before it was finally published. The second study we did only took 12 months. Medically supervised fasting in borderline hypertension. These are patients that you can't justify medication on, but represent 68% of the people having heart attacks and strokes. And of course, their reduction in blood pressure was proportional. These fasts ranged from 5 to 40 days. All the subjects experienced normalization of blood pressure, and this was published in the Journal of Alternative and Complementary Medicine.